Hello everyone. Our presentation is going to be on Ida Jean Orlando's theory. My name is Shannon Lee and I'm working with Carolyn Hoyle, Cathy Shell, and Evan Showalter. Ida Orlando was born in New Jersey on August 12, 1926. She was the fourth of 6 children raised during the Depression. She wanted to become a nurse to better her life, but had to obtain permission to leave her family. At this time, an unmarried female could not leave their family unless special permission from her family was obtained. Once she obtained this permission, she began her career as a public health nurse, obtaining her diploma in 1947, and then following her bachelor's degree of science in 1951. Not only did Orlando obtain this degree, she also obtained a master's degree in mental health in 1954. Orlando was an educated professional who took great initiative in advancing her skills in nursing to ensure excellent patient care. Although she worked as a supervisor, obstetric, and emergency registered nurse, she is primarily known for her focus and influence on psychiatric health. Orlando diligently served in New York and Massachusetts. After Ida Orlando worked in a diverse career as a clinical nurse, she later devoted the rest of her career to being an educator and researcher at honorable facilities such as Yale University until 1961. She became the first psychiatric nurse in the United States to receive a research grant from the National Institute of Mental Health. In 1961, Orlando published her first book, The Dynamic Nurse-Patient Relationship: Function, Process, and Principles. In 1972, Orlando expanded on her book and wrote The Discipline and Teaching of the Nursing Process. Orlando died on November 28, 2007, at the age of 81. Well, we ask, how was her theory developed? Orlando's theory was first published in the Dynamic Nurse-Patient Relationship after a study that she conducted at Yale University. Her theory was developed when she had an interest in integrating mental health concepts into the basic platform of nursing. Her theory focused on nurse-patient relationships and helps the nurse investigate the immediate needs of his or her patient. During Orlando's time, nursing was simply described as good or bad. Her nurse-patient observations she witnessed during her research at Yale opened her eyes to the lack of structure when defining good nursing. She then realized the need for developing the deliberate nursing process, which incorporates assessment, diagnosis, planning, implementation, and evaluation. Orlando's nursing theory is a theory of observation focused on the patient's individual needs rather than the protocol. Orlando's theory saves time and energy for the patient and the nurse. The theory uses patients' behavioral cues, verbal and nonverbal, to assess their needs. The purpose of this theory is to provide for the patient's needs based on meaningful communication. According to Orlando, meeting the patient's immediate needs improves patient outcomes. The goal of the nurse is to improve the patient's condition by meeting their needs. The communication between the nurse and patient must be validated to ensure that the nurse is meeting the patient's needs. Orlando's theory kept the nurses focused on the patient. Orlando's theory ensures that patients are active in their own care and that they are treated as individuals. Next, we look at how does this nursing theory relate to our own personal nursing practice. Treating patients as individuals, involving them and their families in their care, and not treating them like burdens greatly improves communication and outcomes. By consistently assessing the patient's needs and changes, it ensures that the excellent nursing care is delivered in a consistent manner. While working as a nurse, I have relied on nonverbal cues more than verbal language. Often patients undersell their pains, fears, and concerns. My patients have often told me that they hold back on asking for things such as pain medication for the fear of appearing hopeless and needy. It is important to use Orlando's model in these cases to see through that facade and provide the best patient care. As medical professionals, we are consistently assessing patients. Orlando's theory in nursing is built around the assessment skills that we use daily. Orlando was able to identify the nurse's need to investigate patients' needs through conversations and assessments. With proper questioning and social cues, the nurse is able to address patients' needs holistically. We're able to balance and look at strengths and weaknesses of the specific theory. Some of the strengths include patients have an active role and voice in their care, patients are treated as individuals, there's an assertion of nursing independence, and it's based on the theoretical framework, and it guides the nurse to look at the patient as a whole. A few of the weaknesses of this theory are it limits the development of research hypotheses, it's based on short-term care, and it's also the development around the absence of family members and other present parties. Well, how does Orlando's theory stack up to the others? Compared to other theories, Orlando's theory specifically strengthened the role of the nurse. It encouraged patient advocacy and displayed nursing independence. The constant nurse and patient interaction creates an ever-changing plan of care. The persistent interaction between the nurse and patient helped to decrease inaccurate diagnosis and ineffective care plans. This theory is limited because it relates only to patients who are able to converse and is to be used in short-term care. In conclusion, Ida Orlando's theory can be used both by novice and expert nurses to ensure excellent communication and individualized patient care. The patient's behavior dictates the patient's needs, and the nurse must be aware of behaviors and validate communication between him or her and the patient. By individualizing patient care, the nurse is able to meet the patient's immediate needs and improve patient outcomes. Time and energy are saved on both sides by actively involving patients in their own care. Orlando's theory triggered patient-focused nursing care and education for the improvement of patient outcomes. Orlando's success in improving the world around her sets a fabulous example to current and future nurses. Orlando exemplified this through observation and her own personal research. As healthcare professionals, we have to consistently strive to grow and always have a positive impact on our practice. Thank you.